being, a GP for many years, being the chairman of the regional kind of NHS clinical commissioning group, having all this experience of not just the clinical practice, but what goes on behind the scenes, the management side, the financial side, I feel has given me a really good insight into what shapes a good health service, where things can go wrong, but also how things can improve. And although I've worked both in the NHS and the private sector, I feel like what HarleyDoc offers is something very unique. We are trying to bring efficiency, modern efficiency and modern technology into an industry which has lacked technology, lacked efficiency for many, many years. It's often a good place to start a business from addressing a population need. And I feel like that's what we've really done. We offer, our clients 24/7, 365 coverage. We encourage them to sign up as members to our app, although they can use it ad hoc. But what that means is that they get access to a named GP who they can contact 24/7, 365. They get instant response to queries and inquiries that they have. We have a really unique platform with our app whereby we have obviously all the patient's details, the electronic medical record. So whenever you speak to your doctor, they're aware of what your health problems are. You're never starting from scratch. So there's that continuity of care, which makes it differentiated from a lot of health services out there where you're seeing somebody new every time. They might not have time to look through your old records. So what happens is that you start from scratch. That adds time to a consultation, which in a busy clinic can often be fatal, So that's where we started from. And the app offers the ability for patients to book same-day telephone appointments, video appointments, face-to-face appointments, home visits. Currently, we offer that within the M25 for logistical reasons. Patients can see the same doctor, have access to them, but not just in the UK, they can access them wherever they go in the world. So the whole purpose of the app is that it puts the patient care into the palm of the patient. So they have the opportunity to let the healthcare travel with them. What we specialize in is being able to discreetly immerse ourselves into a new country, a new city's healthcare ecosystem, find out where people can access pharmacies, where people can see a doctor, where the hospital is, if there's ever the need for that. Because those things aren't often catered for by conventional private models. And we're very keen to differentiate ourselves from existing insurance models as well. One of my big frustrations with medical insurance is there are often really hefty premiums that people pay on an annual basis, but then lots of exclusion criteria. I'll give you an example. I spoke to you before about my own history of illness. I was diagnosed with bowel cancer at 23, and I've never been able to get life insurance or critical illness insurance since then. And that to me is, number one, it's unacceptable. It affects me directly and my family. But what it also does is it makes me, when I have gone to the private health companies, they'll give me in the tens of thousands of pounds premium to pay a year, and then they'll say we won't cover anything in the gastrointestinal tract, which basically is all my body. So what kind of a service is that, And so on top of that, if I'm, paying a £500 excess every time I use the service, it just seems a very corrupt model, the health insurance model. And I think it needs revamping. And we're hoping that we disrupt that, because for you to spend tens of thousands of pounds with HarleyDoc, you'd have to be contacting your doctor on a daily basis, which nobody ever does. We feel like it's an affordable alternative to existing private healthcare models. It offers a unique take on kind of health tech being, kind of dovetailed with traditional kind of medical models. And it means that you have the ability to do a video call from anywhere in the world. With our remote patient monitoring, you can do your scan even in the, middle of the desert. If you have network coverage, you can still be able to access the technology, do a scan, and we can see what your metrics are. If you're showing that your blood pressure is high, if you're showing that you're breathing too quickly, we can see those things and then make sure that it triggers the consultation that you need. You have access to our patient education training hub. You have access to our medicines management, so our prescribing platform. We can have any medication delivered to you within an hour of wherever you work in central London. So I think that, kind of dealing with these kind of highly functioning people who work in these government jobs and, run their own companies, they're often so busy in their daily life that they expect and they deserve that efficiency in the healthcare that we provide for them. And we feel that that's what HarleyDoc offers. It's the most efficient way of somebody signing up to a healthcare platform and having same-day access to a doctor who they can contact and build a rapport with, as things used to be kind of generations ago, where you knew your family doctor and your family doctor knew you. So you're never starting from scratch and you have that continuity of care. If you can have a problem that you can instantly speak with a doctor about, instantly have a management plan put into place, and be told, okay, check your blood pressure and pulse for the next week or month or 6 months, and we can immediately have that data coming back to us. It offers a real-time offering which has never been seen before in healthcare.